Hi, welcome to the Military Wallet YouTube channel and podcast. I'm joined today by Heather Campbell, a military spouse, registered dietitian, and advocate for military family quality of life issues, especially food insecurity. Now, after personally experiencing the challenges of feeding a growing family on military pay, Heather became passionate about helping other military families navigate financial stress, grocery budgeting, nutrition, and access to resources. Through her advocacy work, Heather is helping raise awareness about an issue that often remains hidden in the military community. Heather, welcome to the show. Thank you for joining us.
Thank you for having me. I love talking about this topic, and especially when it comes to talking about my community, the military and veteran community. It's often not something people are excited to talk about, but I really love it. I think it's important, and so thank you so much for giving me an opportunity to share about the work that I do.
We're happy to have you on. Now, I know this is not a popular topic for many reasons, but it's also something that's very misunderstood. You know, many people assume that because military members have chow halls available to them, or dining facilities, if you will, or we get pay as a benefit for basic allowance for subsistence, that we should have everything covered. But the reality is, inflation is real, food costs are rising, military pay doesn't always keep up with civilian pay, and life is it's just expensive. So it's a complicated topic. It's not very easy to pinpoint one certain thing. So why don't we start at the beginning? Why don't you tell us a little bit about your story and how you got involved with this, with dealing with food insecurity?
Yes, I have a term that I use that I did not invent, but a friend of mine, Megan, calls herself all the time an accidental advocate. And I feel like my journey into advocacy just aligns with that so well. So I am accidentally an advocate and one of the leading experts on food insecurity in the military. It was a big transition to call myself a subject matter expert. And I remember talking to someone and saying, I don't feel like I'm that topic. They said, well, does anybody, in this space know more about it than you? I said, well, no. So I guess by default, I became the expert in this. And a little bit about my family. I'm married to an active duty Air Force member. He is an officer, and this was not something we ever expected to experience. And the reason I share my story is because that very first thing I said, I'm married to a service member who's an officer. I have 2 degrees. I have a bachelor's degree and a master's degree. When we got married, he had his bachelor's degree. He didn't yet have graduate school, but we had some student debt. He had a career starter loan, kind of a hodgepodge of different things, private student debt from undergrad, federal student debt from graduate school. So none of those, when you think about just the very basics, right? Starting the story, oh, well, you can consolidate loans. Well, you can't put private loans and Fed loans together, or it's not very recommended to do so. His being a career starter loan couldn't be consolidated with any of ours. So we had sort of these different pockets of student debt that didn't really qualify for any assistance anywhere. And we couldn't sort of show up on, say, a debt to income ratio for WIC eligibility. So fast forward, we get married. I work a couple of years. We have kids a little sooner than we were expecting. And then we end up in a really remote duty station. We were in Alaska at Eielson Air Force Base, which is about 40 minutes south of Fairbanks, Alaska. It's about 100 miles from the Arctic Circle. So we were way, way up there in a small base at a faraway place, and resources were really limited. Employment opportunities were really limited, and childcare was really limited. And I sort of had this spiral that we hear in the spouse community a lot of, well, I can't put my kids in childcare because I can't afford it unless I have a job, but I can't accept a job offer until I have childcare, and the wait's more than a year. So it was just sort of this loop that we were stuck in. And even as an officer family, we missed WIC eligibility, which is the SNAP benefit. It's the Supplemental Nutrition Assistance Program for women, infant, and children, excuse me. And it's based on income, and it's, kids under the age of 5, pregnant, nursing, and postpartum women get nutrition support. We think it's important that that's a stage of life. Nutrition should be adequate. And so there's this government program out there for that. Well, it's income based. Most people wouldn't think military would qualify, let alone an officer. And we missed eligibility by $67 a month. But because of that debt that I mentioned, that career starter loan, that undergrad loan, that graduate school loan, we were paying about $1,500 a month in student debt. So we were living, our livable budget was way, way below the income eligibility line, but we didn't qualify. And then as an officer, when you do different things and official events, you're expected to buy extra tickets to the annual awards, to the Christmas party. You bring the ham and the turkey to the Thanksgiving and all of these things. And at the time, about 15 years ago, there weren't a lot of resources available to us other than go to finance, take a budget class. Now, a little bit about my career. I worked in finance all through undergrad. I worked in banking for 2 years and then in student loan servicing. So I uniquely had a great perspective of finance and personal finance and budgeting, before I was even 21. And I studied nutrition and pediatric and family nutrition. So I have this professional expertise, right, of how to feed families and how to feed growing kids. And I have this professional experience of almost 3 years working in finance. And I did data and research and all of this stuff. All of that to say, I really love Excel. I'm very good at numbers and I'm good at feeding people. So when we got to this season of, okay, we don't qualify for any assistance. Okay, we don't qualify for debt consolidation, but we're really struggling to make the budget work. We were driving used cars, we were getting secondhand clothes, we were doing all of those things, and we were still really struggling to make ends meet. We never went without, but it was a constant mental load. It was a constant stressor of if the shocks and struts go out in the car, how are we going to do that? Mind you, we have credit cards available. We don't carry balances on our credit cards. That was really important to us. So when I talk about some of these stressors, I'm talking about the monthly budget, right? Trying to just zero out at the end of the month and not rely on credit cards, although those are available, but it's not something that wants to be a holding pattern for debt for our family. So with that, we really struggled, and I felt like, you know, motherhood was hard because I must not be a good mom. It turns out 3 kids under the age of 4 in Alaska, primarily by yourself, is actually just really hard. Um, I thought that I wasn't a good stay-at-home mom because I didn't love just being home with the kids, and so it must mean I'm not a good wife. Maybe I'm not cut out for motherhood. I'm not cut out for being married to the military, and money is tight because I can't find a job, and we've got these kids, and this burden on our family would just go away if I went away. If I went away, if something happened to me, the debt would go away, my family would be better off. And there was this very real spiral in that season of feeling like I have all this expertise and experience. Why can't I provide for my family? Right. So I say that to say now on this end, getting into a little bit out of that survival mode of parenting, a little bit more able to breathe and look around and say, wait a second, hang on. That was really hard. Why was it hard? Kind of looking back into it, why was it hard for us? What were we struggling with? Where were the pain points? Where were the gaps in the system that we fell through because we got sent back to Alaska? This was while we lived somewhere else. We were heading back to Alaska in a leadership role. And so I said, wait, before we go back there, I need to understand what happened to our family because we're going to be leading those families there. What's available? Where are resources? Where did we not look? What can we do to make sure the families that we're taking care of while we're there aren't struggling with this? And then that spiraled and spiraled and spiraled into a data wormhole. And it turns out this is a widespread thing in the military community. About 1 in 4 families are struggling to put food on the table. And I want to, put a pin in that for a second and just define our terms when we're talking about food insecurity. A lot of people think food insecurity. One, I had someone think that your food wasn't secure, that like maybe someone was going to steal it from your home. That's not what we're talking about. It's also not hunger. Hunger is a lack of calories, a lack of energy, a lack of nutrition, right? You think about people wasting away from hunger, from famine. That's not food insecurity. According to the Office of Disease Prevention and Health Promotion, food insecurity is a household level economic and social condition of limited or uncertain access to adequate food. So it doesn't mean that you're going hungry. You might end up fine at the end of the pay period, the month, the week, but you're constantly wondering, am I going to make it? Do I have what I need? Do my kids have what they need? Does my spouse have what they need? What do we do if a finance emergency comes up? How are we going to withstand that? And that mental load, when we're talking about our war fighters, right, from a military perspective, we're talking about our all volunteer service who are willing to put their life on the line. We're recording near Memorial Day currently, and we just had this moment of pause for people who've given their life for our country to know that 1 in 4 of them are struggling to even put food on the table. I that didn't sit well with me. I didn't take that lightly. So then I sort of used my expertise and my experience to serve where I could, develop programs, develop resources, and advocate at high levels with decision makers, with Congress, with our military leaders, and with community partners to say, hey, let's understand this. Here's what we can do. Here's what needs to be done on big scale, local scale, and then also what families could do individually, because ideally I don't want anybody to go through that season how we went through it, feeling unsupported, feeling alone, and feeling like something that they've done is the problem. I want them to feel empowered and ready to move forward in the future. So that's sort of how I started, how we went through it, and then kind of how I work in that space now.
Well, thank you so much for sharing that. And I want to take a step back and actually highlight when you're talking about going through a period in a season of depression. And, that is a reality that, first of all, I want to thank you for being brave enough to share that with us. But I want others to hear that and realize, I want to pause for a moment and give people the understanding that if you have those feelings, you're not alone. You're not the only person experiencing this. So there are resources, and Heather's going to help us with those, not just with the food, but also with, take a step back and please get some help so that you can get through this, because your family is better off with you around in your community. And gosh, yeah,
Well, and now we
100%.
have this great resource, 988. It's been around for a couple of years. It's the
Yeah.
emergency line for mental health support. And that wasn't around, back in my day, but that
Yeah.
wasn't a thing then. And we were in a remote location. There weren't a lot of resources available, even from a mental health perspective. And I had tiny children at home and a husband gone a lot. So if I do go, say, get inpatient help, what happens to my kids? So it was really a unique situation. But it turns out it's not as much of an outlier as I thought. But now we have things like 988 that you can call and you can text and you can speak to somebody immediately and say, hey, this is what I'm struggling with. What's in my local area? What can you connect me to? Um, and so I tell people about that resource all the time. I'm not affiliated with 988, but
Yeah.
I wish that they were there when I needed them back in the day.
Yeah. Well, thank you for sharing that. So thank you also for defining food insecurity, because like you said, there are misconceptions about what it is. And you gave us a definition, but also in practical terms, what it means. So now that we have a little bit of a definition, we know where you're coming from. When we're talking about food insecurity, can we start kind of at the basics? What does it mean for it could be anybody who it impacts. We could start with that if you want. Talk about who might be experiencing food insecurity, what that looks like for them. And we can just kind of do a little back and forth. And, I'll throw a couple questions or scenarios, and maybe we can play through things a little bit just to kind of get a feel of who this impacts and what we might be looking at when we examine this topic.
Yeah, absolutely. That's such a great starting point. So for food insecurity, we often think, 18-year-old. My sister got married. They've been married almost 20 years, but she got married as a teenager to a young Marine, and they've done 20 years in the Marine Corps together. And they have just, beat the odds. But we think people like my sister, right? Getting married at 18, moving off, maybe not having a career yet or education or having babies young. That's not necessarily who it is. We see that the highest sort of band of rank in the military community is that NCO, like that E4 to E7, because our very, very young or our very, early career lowest earners, they do have things like the dorms, they do have dining facilities, or they do have the chow hall. But once you're married, once you have a partner and you have a spouse and you have dependents and you're living off installation or even in housing, that's not available in the same way, or you're now having to pay for it. I want to stop there and say some of those lowest income earners, they have resources like that, but they also qualify for things like SNAP, for WIC, and a lot of emergency support services where if you go and you look, even, scholarship programs or financial aid, it stops, hey, if you're this rank or above, we assume you're good. The problem is when we get into that rank, you've now maybe picked up a spouse or some kids, a couple dependents, probably lost whatever that person was bringing in. If you're moving around, you've probably lost childcare and lost income. Now you have more mouths to feed with less money to do so. Oh, and also that benefit you qualified for at E4, you now don't get at E5. So that's something to understand is it's not these very youngest, well, they shouldn't have had kids at 20. I'll address that later. But also it's those families that are kind of right on the edge. That you make $67 too much and now you get nothing. Think of like Willy Wonka, like you get nothing. Good day, sir. Like you get nothing. You make enough. You could have $800 worth of benefits. Oh, you made 67 more dollars. You get nothing now. So that's really where we're seeing it, whether it's in the civilian community or whether it's, in the military community. It's those families right on the line who maybe don't qualify for assistance or not as much. And then they have different things that pop up, a move, some of the causal factors for military families. These are from the Military Family Advisory Network, also known as MFAN. They did some research back in 2020 saying, hey, food insecurity is a thing. Why is this happening to these families? What's going on? So they found common causal factors as they went through and got all their data. One is spouse unemployment, which we know is higher in the military community than in our civilian partners. I saw something over the weekend that the average American, when you get into this one demographic, it's 14% have higher education and like technical training. Military spouses are at 43%. So we're not uneducated. We're actually more educated than the average public. We just can't get and keep jobs. So spouse unemployment, right? You're losing an income. Growing your family in whatever means that looks like, more mouths to feed costs more money, a recent move, and all that entails, things that are broken, things that are lost, deposits, setting up new utilities, setting up a new place to live, all of that costs money. Unexpected expenses like shocks and struts or breaks or the washing machine dies in the move and your movers won't cover it because they can't prove they broke it and now you have to buy a new washing machine. Those kinds of things, as well as external system shock. So at the time they did this data, they did it during a storm that hit the Hampton Roads area, like a hurricane. And then also there's a huge ice storm in Texas, and it was also on the heels of the pandemic. So it turns out within our community, some of these big shocks, flood, fires, hurricane, ice storms, inflation, if you've had limited access to your local community through in immigration concerns, or even a pandemic, all of those things are extra stressors that we're not prepared to handle because of everything else. So when we're looking at why is this happening or who is this happening to, it it could be any of us. We just had I just wrote someone about this recently. We're getting ready to move and we're still active duty, moving again as we do. And we've set aside some money. Okay, we know that moves are expensive. I think the last I heard was about $5,000 on average out of pocket for each move. Okay, let's set that aside. Let's get ready. Well, we had a storm come through. We own our home. We get to do a new roof, which is covered by insurance, but we still have a 4-figure deductible. We need to put carpet in the house. We knew that when we bought it, but that's a 4-figure number. My husband's truck had some normal wear and tear, but it needs to be done before we, move far away and hit the interstate. That's a 4-figure number. And what I thought was a small plumbing thing turned into a big plumbing thing that's also a 4-figure number. So in the last 2 weeks, I've added $10,000 to my budget for this quarter.
Yeah. That's
That's
that's tough to do.
that's a lot, right? So that's
Yeah.
stressful to be like, "Oh, man, that moving cushion that I set aside is now used for these normal things, which need to happen. However, now I'm entering a move with no cushion," right? So I say that to say my story's not special. It's special to me. It's unique to my experience, but this is happening to people all the time. We just don't always have the resources to withstand it. So that's where that conversation for military comes in is it's not as simple as you should budget better or you should get a job. There's a lot more nuance into all of those barriers than we might realize.
Oh, for sure. And I think your personal story highlights that very well because of you were an officer spouse. You have that background in finance. You know how to do a budget. You're a dietitian. You are set up for success by every external factor. But when you're looking at it from the outside, but on the inside, you're saying, but the numbers don't work. And when the math doesn't math, there's some kind of other issue at play. So that's one of the issues I guess we can look at next because there have to be some misconceptions, I'm assuming, about the military community. We've kind of covered some of those. When you're looking at this from the outside and when you're doing advocation and you are speaking to maybe it's military leadership, maybe if you're talking to legislators or Congress people about this issue, what are some of the misconceptions they have, and how are you addressing that with them?
Well, one is the way that military pay is given, and in my experience is as an active duty spouse, and so that's, sort of what I'll speak to because once we get into Guard and Reserve, there's a lot more, different ways that finance can be sort of earmarked on that income statement, but we'll stick with the basics. So for military pay, you have your basic pay. That's congressionally set. Look up somebody's rank and how many years they've been doing it, and, like, you'll find their pay right there, on the government website. There's also something called BAS. It's your basic allowance for sustenance. That's your food allowance. That is designed to feed the service member only. You pick up a spouse, you pick up some kids, that number doesn't change. Back in 2022, when I was briefing at a leadership conference in the Air Force, I talked about that number. I think at the time the BAS was like $280, and the estimated number, the monthly budget to feed a male between the ages of 20 and 50 was $285. So, I presented this and I said, hey, for officers, and it's different for officer and enlisted, officers get less. I said, for officers, you're giving them $280, but we see that for males 20 to 50, it costs $285. So don't talk to me about the food allowance. It's not even covering their needs. To which someone asked, well, are you saying that we need to pay them more for food? Aren't they officers? Can't they pay out of pocket for their food? I said, sure, we could tell enlisted that we'll help with their food and tell officers to pay for it on their own. But then that starts bringing down that officer number, right? That incentive of, oh, officers get paid more. Well, we don't give them a food allowance as much, and we don't give them a clothing allowance, and they don't get career bonuses. Okay, those all matter, right? So when we're having that conversation, you have to look at that knowing that that's designed to feed the service member, which is great, but we can't factor it in when we're talking about families and feeding families. So that's one. Another allowance that we see a lot is the basic allowance for housing. Now, back in 2015, Congress decided to reduce that by a percent every year until it got down to 95%. So it is set at 95% of what your housing needs should be. Here's the deal. We have an entire cabinet department dedicated to housing. And they look at all of these different zip codes. They have all of this information. You can go in and that determines what Section 8 is paying for rent or what your SNAP benefits are in a zip code. Yeah, the Department of War doesn't use those numbers. They use their own numbers. So their own algorithm that they go in and they determine based on where the installation is located. As you know, many installations are not in the best part of town. So they're looking at that zip code for what 95% of the cost of an apartment in that zip code is. So when we talk about a family, they might not want their kids going to school or living in the zip code outside of the gate where even there it's 95% of the cost. So that doesn't mean that necessarily that should be changed, maybe re-examined. And I think we should just either do 100% or not, because also when that decision was made, the economy was in a different place than it was, now post pandemic and now with inflation. So that factors into that conversation. So when we say that housing allowance, it's not quite what you think. I know when we moved to Virginia, we were going to be there only 10 months. So we were waiting for base housing. It was full. We had to wait about 2 months. And someone had asked, well, why don't you live off post, and look there? Well, for the school district that we were going to be in, which is the base housing school district, it was going to cost us about $1,000 out of pocket in addition to the housing allowance per month to live in that area. We had just gone through a move. We didn't have $10,000 to cover housing expenses in addition to all of the other move stuff. So that's some of that conversation of just understanding how that all looks and even knowing that the housing allowance is based on an apartment, not a townhome and not a single family home. For an officer, it doesn't start counting towards 95% of the cost of a single family home until you have been in for 14 years and you make the rank of either O4 or O5.
Yeah, I think it's '04 for something like for that, and
Yeah.
the BAH website actually covers it and breaks it all down.
Yes.
So
So it helps, but it
Yeah,
doesn't cover all the housing.
yeah, and I
Yeah.
think that's kind of an understanding that many military members have. They know their BAH isn't gonna cover 100% of everything. It's not gonna cover all of their utilities and everything else. So there are going to be out-of-pocket expenses, and
Especially those of us who have been around for a while. We already know.
we do, yes, but, congressional leadership might not understand that, and senior military leadership is often pretty far removed from that because they came up in a different time, and they've reached an point in their career where they are earning more, their BAH covers, probably closer to their full housing, or, when you're talking about general officers, many of them live on post because they're required to in
Yep.
really, really nice housing. So,
Yeah.
there are a lot of kind of separations between senior leadership and those who are out in the field. So, okay, that we kind of defined the problem a little bit. Now let's talk about military families. So, let's get a little bit into the psychology about this. So you talked about the struggles you had personally, but it's also something I don't think many military families are raising their hands about and saying, "Hey, I'm struggling over here." From a military member perspective, and you're married to one, you understand this. It's I don't want to say frowned upon to say I need help, but we tend to take the position of I'm in the military, I'm a man or I'm a woman, I am leading, I am supposed to be strong. I shouldn't admit that I need help. And that's often not the best course to take, but it is often the course we do take. What are some of, why I guess do so many family members struggle, but don't really raise their hand when is it because they don't know? Can we talk about this a little bit and then talk about how we can address this as a community and how you're helping families when it comes to light that they do need help?
I think you're absolutely right. Not wanting to ask for help is definitely, at the foundation of this community, but also because remember I said that that income band, that rank band is right in that NCO phase. You've been doing this maybe 5 to 10 years. You might be in some sort of starting positions of leadership. So you're expected to take care of your younger folks, right? Well, how can I go tell the boss or go, tell the base services that I need support? I should be getting my young airmen, my young soldiers, my young Marines the help they should be getting that, not me. So I think there's also that side of it of, well, somebody needs it more than me, so I'm just going to swallow this and suffer in silence. Also with food insecurity, when we're talking, it all comes down to finance, right? Finance, I can't not pay my house bill, my car payment, my cell phone, those things have to get paid, my utilities, those have to get paid. But I could skimp on some groceries. I could skip a meal. I could eat less than normal. I could make sure that my kids are eating and maybe I'll just, go to bed hungry. That's a lot more invisible. That's a lot easier to hide. So, when we first of all say, well, why is it food insecurity? Let's remember this is just an economic difficulty that's manifesting in food. That's where they're able to find some flex, or that's where they're able to kind of hide it. Also, it's hard to know what services and resources are available. It changes by location. We have some things through our armed services that are pretty standard, right? That you find at every we're Air Force, so you have an airman's attic or you have a thrift shop, those kinds of things. But you could go somewhere like Langley Air Force Base, which is joint. So now I've got Army services available that maybe I wasn't aware of. But also, it's a different zip code. It's a different city, state, part of the country. There might be things available, in Fairbanks, Alaska that aren't available in Montgomery, Alabama, or in Hampton Roads, Virginia, and vice versa. So that is one of the tricky parts. And when we get in that mental load of moving, I'm in the middle of it now. Every single item I own, I will touch. I will touch every single thing that all 5 of us own. I wish that my entire family was minimalists. Like I don't want any of these belongings anymore. But I have to rehome where the plates go, and do we have a linen closet? Do the towels go? All of that stuff, plus the new vet, the new dentist, the new orthodontist, the new dermatologist, the new specialist, the new doctor, the new schools. I have 3 different schools to register for. All of those things. Oh, and also I need to research the new place we live and see what food resources or housing resources are available that might not be military related. That all falls on us as a service member and as their families. And quite frankly, sometimes when you're in the thick of it and you're not sure if you're going to put food on the table, you just don't have the brain space to go looking for more resources that very likely have phone numbers that don't work or broken links that take you nowhere.
fair enough.
Like,
Okay,
we're just
so
tired.
yeah, yeah, and I know moving is a big thing, and that can obviously impact budgets as well. So, and I'm sure that something as complicated as food insecurity, it can just be for a season. It doesn't necessarily
Yes,
mean that it's a full-time thing. It could
right,
just be, hey, we hit this string of bad luck, or as you mentioned, you have all these expenses coming up with the
right,
new roof, the new rugs and carpets, the car repairs, the impending PCS move. And there are times when our budgets are strained a little bit more than usual. So
right.
let's talk a little bit about some of the practical solutions we can look at. So when you talk to new families who are struggling with food insecurity, they're maybe coming to you for help, or what are some ways, perhaps as you can approach it as a dietitian, you can approach it as how, some of the resources, you did cover some of that, but what are some practical solutions that are available to family members, even if it's from an education of learning how to shop?
Yeah, the first thing is you gotta get out of, like, nutrition, diet, influencer wellness culture. It is not as complicated as the person on your screen who happens to be selling a supplement is telling you. It's just not that complex. We have lots of pendulum swings and fads of what research says, but if you kinda stay in the middle ground, you're gonna be pretty good outside of a medical diagnosis for a specific diet, right? So let's sort of keep that in mind at first. And then you want to, just like anything, just like your finances, just like, leaving on a vacation, you want to have a plan, a general idea of where you're going. I'm not going to get in my car in Montgomery and head to Fairbanks, Alaska and like wing it and hope for the best. Like, we're going to have some benchmarks in place of where we're stopping, where I can buy gas, where my kids can go to the restroom. Like, we're going to have a plan. So when you're looking at how you're going to eat for the week, I always recommend starting with what you have at home. What do you have? I'm in the middle of moving. So we're shopping from the pantry first. So what's in my freezer, my fridge, my pantry space that I've already purchased or acquired through a neighbor giving food away, or through a food, donation or an emergency box, whatever that looks like. What am I starting with? Right? What have I already put into my home that I can cook with? And then I always look, next is I always start with the schedule of the week. That's because I have 3 kids and lots of activities, so that determines what's available for each week from a brain space perspective. Wednesdays, we have piano, and then we have church activities. Wednesdays aren't the night that I'm making a big meal. Wednesdays either like a crock pot or a drive-through, and that's just the Wednesday routine. And so from a mental load standpoint, I give myself permission to not really worry about Wednesday. Wednesday's gonna be something easy, leftovers, drive-through, and sort of starting to look at that, whatever your pain point is. If it's budget, if it's schedule, if it's picky eaters, okay, what do I have to work with? Basically, is where am I starting? And then I start looking at what's available to me. Do I have WIC? Do I have SNAP? Do I have an Airman's Attic? Do I have a food giveaway? What's the local grocery store? What's their ad? Do I have their shopping app that gives me coupons or fuel points, or apps, or whatever? What resources are already available to me, especially if they're $0, that I can then use to my benefit? I live somewhere near a grocery store chain called Publix. It can be quite spendy. I shop the Publix BOGO ad. I wish I had it in front of me. I just wrote it down, but the day that it turns over each week, I go through and I see what's on sale this week, and that's where I start my planning. This week, ribeye steaks are on sale. Currently, those are out of our normal budget. They're on a pretty good sale, so I think we're going to have steaks this weekend, and I'm excited because I looked at the ad. So, starting with what do I need to use in my home, then what's on sale, especially if it's items that you know that your family eats normally or uses normally, right? Toilet paper, paper products, consumables. And as long as you have the space to store them. We did once go salmon fishing in Alaska and come home with a freezer full of salmon. Very exciting. We didn't have a freezer to put said salmon in. So we had to stop at like a store on the way home and buy a deep freeze to put the fish in. So don't do that. Don't buy food that you don't have storage space for. But if you know that you have adequate dry space, but your, refrigerator and freezer's more limited, then don't overdo it there. If you know that you've got a deep freeze, but maybe not extra fridge space, well, what can I buy that I can keep in my freezer? So when you do see some of those sale items, what maybe is normally out of reach that's on sale this week? what's a staple for us that I know I can stock up on and store up so that the next time I'm not having to buy it at full price. So those are kind of two places I always say to start is what's already available to you and what can you acquire? What are your, your sourcing options for bringing stuff into your home and looking at your schedule. And then from there, you can be like, okay, looks like this is what's on sale. This is what's in the house. And then you can start planning out what the week will look like to make your grocery list.
Yeah, I think that's great. Yeah, some of the things that we do, we don't eat a lot of steak, but if I find a deal that's kind of like that buy one get one,
Yep.
then I'd consider it. But most of the time, it's out of reach.
Yeah.
It's very
Yeah.
expensive. So more of a special occasion or a buy one get one.
Yep.
We do a lot of store products. So the generic,
Yep.
instead of buying the brand name, many of them are just white labeled. They're made in the same or similar factories. So you're getting the same stuff. It's
Yep.
just a different label. And a lot of times you won't notice much of a difference. We also will do vegetarian meals a couple nights a week. We do a
Yeah.
lot of soups or stews, or chickpeas are really good, salads and things like that. Or you can use meat as more of a flavoring or a part of
Yes.
the meal. And ground beef or chicken or turkey goes well in certain meals instead of just having this giant slab of meat. So we do a lot of that, and that helps a lot with our grocery budget. Costco, Sam's, BJ's, warehouse
Yep.
clubs can be helpful if you aren't going overboard, like you said, and you have a place to store it. So, what are some of the resources? For example, I know the commissary sometimes will have the lot sales where you can go buy things. What about food pantries or churches or food drives, local nonprofits? What are some of the ways people can use those? And for somebody using it the first time, what are some of the things they should know? Because I know sometimes we don't want to say we need help. So, what are some of the approaches, and what is that like? And can you just reassure people it's okay to say yes, I need help?
Well, now, in the age of social media, there's no shortage of resources for finding a recipe. So if you want something, you're getting a more affordable or you're getting a food pantry item and like, okay, what in the heck can I make with chickpeas? Google will tell you. I guarantee between AI and social media, you know, trends, there's something out there to be able to do that. But also realizing that some of these foods are more processed in the way that they have sugar or salt added to them. Now, I'm not against processed foods. Strawberries that are frozen and ready for a smoothie, that counts as a processed food because somebody else picked them, chopped them, and froze them, right? So we're gonna not say avoid processed foods. No, we're process and convenience have their place, especially when you're balancing the mental load of a household. Sometimes it's worth it to just buy the bag salad and not chop 17 different vegetables. But with that, knowing that there's some things you can do for like canned vegetables, just rinse them in water. Just rinse them, in your colander. That removes up to 30% of the salt. So rather than dumping, your can of corn straight into the pot to warm up, you can just run. You don't even need to use a colander. Just sort of, loosen the top, run some water through it, and then you can warm it up. So that can help from like a sodium content standpoint. And also you can add stuff to existing recipes. We love to do ground beef tacos. Ground beef is getting really expensive, and we have 5 people, so we're usually doing 2 pounds of meat. So we've started adding ground chicken, which is a lot cheaper, and we'll do half ground beef so we get that really great flavor and half ground chicken. Or we'll add in things like finely chopped mushrooms because my family doesn't really like them, but it's a great source of phytochemicals. And then we'll add in some canned black beans, and then that pound of meat can go a lot farther. And we've added in some things like vegetables, fruits and vegetables, anything that you can add with whole grains or fruits and vegetables are going to be a great option. You can take something like ramen noodles and you can hard boil an egg, soak it in a little bit of soy sauce for I think it's like 15 minutes up to a certain amount of time. I don't remember the specifics, so definitely look on socials or online. But you can make this like soy egg, and then you can add a little bit of like bok choy and wilt it in there when you make up your ramen. And now you've got a ramen with some veggies in it and with a protein in it. And ramen is really, really affordable. So there's definitely ways you can take some of these more affordable items and incorporate them in some of your favorite recipes or use them as a base and then add the other things for flavor or for nutrients that maybe wouldn't be as available to you as adding them into something. The ribeyes that we're going to get, we'll cook those up, and then whatever's left over we'll make into either a stir fry or like a quesadilla or, like a breakfast scramble or something, making sure that you're not wasting food and trying to reuse those leftovers it is really a great way to stretch that dollar again on things you've already purchased. And now you can get the most out of those dollars and out of that food item that you already have.
Yeah, I love those ideas. We actually do the same thing when we do like ground beef or turkey or chicken. We will add chopped mushrooms or black beans, especially. And yeah, we do that a lot. It's a great way to extend what you have and kind of bulk it out. But I actually like the flavor of it a lot more
Yeah.
too, because you get more depth and variety of
Yes.
flavors and textures. You're getting deeper nutrient value as well. So we do that. I think that's a great tip. So as we're talking through this, and I love those tips that you have, what are, I guess, some calls to action for some individuals who might be struggling with food insecurity? How would you guide them through the initial steps and help them find more specific help?
The first thing I would do would be to, acknowledge that it's possible that you're just in that sweet spot where some of these systems don't serve you well and things are more expensive now than they've ever been. And that's okay. And so acknowledging, hey, this is really difficult. I want to look for some resources. I want to look for support. That could be as simple as getting some friends together and doing a meal swap where you make five casseroles and they make five casseroles and you all swap them out and take them home. Doing some sort of like food prepping meal, recipe prepping like that. You can go and look in your I'm sure if you go to your Fleet and Family Services, Army Relief, I think Army Emergency Relief, the community services on Army, I think it's ACS, Army Community Services, and we have the military family readiness on Air Force bases and Space Force. But going to those and saying, "Hey, what's available here? What's Air Force, Space Force, what's military available, but also where's the local WIC office?" They're gonna know. Where can I, see if I qualify for SNAP or for Medicaid or for Medicare? And when you talk to those offices, even if you don't qualify for WIC, they're going to have resources and lists of food pantries. You can also do a quick, if you go to feedingamerica.org, just go in there, you can put in your zip code. It's going to tell you what food bank serves your local area. Every single county in the country is assigned to a food bank. Your food bank is your distribution. It's like your warehouse, and they send it out to pantries that give it to people. So here in Montgomery, we have a big food bank that sends it out to multiple community centers, churches, that sort of thing. So that would be a great source is what food bank is assigned to my zip code. They're going to tell me what's in my local area, if there's an income requirement, how often it's available. All of those kinds of things are available, through that one spot of going to feedingamerica.org.
Oh, thanks so much. I think, information is one thing. It can often be overwhelming not knowing where to go, and then when you have that information, what do I do with it, that kind of thing. So I appreciate you sharing your story, both kind of the mechanics of it, but also really the emotional connection that you had and the experiences that you had, because anybody who's listening, if you're experiencing food insecurity, if you're having trouble making ends meet, you are not alone. It can happen to anybody. As Heather mentioned, she is an officer's spouse. It is common for young troops. It's common for kind of mid-career troops. So you're not alone. There are great resources out there for you. Do you have any parting thoughts, or is there one message you want people to have when they're listening to this?
Yeah, I would say, to follow up what you said, if you're struggling, there are resources available. You aren't alone. One of the things that I've developed within the community is a free workshop for military and veteran families. It's called Fuel the Home Front. It's about 90 minutes long. The modules are little bite-sized chunks, all of the puns intended. And they're about 5 to 15 minutes, and it'll be how to have an emergency backup, how to eat out on a budget, how to meal plan, how to shop for groceries, how to budget for groceries. All of that is in there, and we walk through that with a nonprofit I volunteer with called Independent that's dedicated to military spouse wellness. So that is out there. Again, Fuel the Home Front, that is free. It'll be a recap of everything that we've talked about and also a little more in depth. But Also, even if you are struggling because you've made poor financial decisions, even if you brought this on yourself, as a human being, you're no less deserving of support and resources to move forward with better options and with better support and with confidence. So, whether you're the person experiencing difficulty or you're in a position to help people around you, I really don't care how somebody got to a point of needing help. This is where I meet them. I meet them at the point they're asking for help and help them find what they need. So I would just encourage all of us neighbors, all of us community members to see this could happen to anybody very quickly. And, blaming people for the circumstance they're in isn't helpful, but we do have an opportunity to help and to support each other. And then we're all better for it. And especially in the military community, when our war fighters are strong at home, when their homes are safe, stable, and secure, we know that they can show up and they can do the mission that we need them to do.
Awesome. Well, thanks so much, Heather. I appreciate you sharing your story with all of us. I appreciate you sharing these resources. Fuel the Home Front. We will get a link to that in the show notes and we'll make sure to highlight that. Thank you for sharing that with our community. And thank you so much for serving America's warfighters.
Absolutely.